Hypothyroidism is a disease in which the thyroid glands become inefficient in secreting the major thyroid hormones that are tetraiodothyronin T4 and triiodothyronin T3. During pregnancy, the thyroid pathology can worsen, and if the condition of hypothyroidism arises during the gestation period, then it is termed as maternal hypothyroidism. Hypothyroidism is one of the greatest complications that can happen during pregnancy, yet not many people are aware of it. So in our video, we will explore the details of maternal hypothyroidism. What complications can arise due to maternal hypothyroidism? Maternal hypothyroidism is a very serious ailment because even after medication and treatment, this poses danger to the mother as well as the baby. Deficiency in thyroid hormones can cause a baby to be underdeveloped because thyroid hormones help in maturation of the central nervous system. Decreased thyroid hormone levels can result in problems in metabolism as well. According to research, the growing fetus is heavily dependent on maternal T3 and T4 hormones during the first trimester. Expecting mothers need to be very observant of their diet, exercise, lifestyle, etc. to ensure that no such complications take place. What are the common causes of maternal hypothyroidism? Hashimoto disease or the Hashimoto thyroiditis is an autoimmune disease wherein your immune system attacks the thyroid. People with this disease may have symptoms of hypothyroidism or may not notice the effects at all. Iodine deficiency. Prior treatment for hyperthyroidism. Surgery to remove thyroid tumors. The thyroid glands can also become underactive after childbirth, which will again lead to hypothyroidism. About 7% of women experience postpartum thyroiditis months after delivering their baby. Thyroiditis or inflammation of the thyroid can lead to both hyper as well as hypothyroidism. Who is at risk? There are some risk factors that render some women more vulnerable to maternal hypothyroidism than others. If you fall under any of these categories, it does not mean that you will surely get hypothyroidism, but you must be very aware of this. The risk factors are past infertility or preterm delivery, a family history of thyroid or autoimmune disease, type 1 diabetes or other autoimmune disease, prior radiation treatment of the head or the neck, past thyroid surgery, attack by thyroid antibodies, mainly thyroid peroxidase, TPO antibodies, which are often present in Hashimoto's disease, a goiter, enlargement of the thyroid gland. Symptoms to look out for. It is important to know that some people with mild or early hypothyroidism might not experience any symptoms. Some of the symptoms of hypothyroidism are the same as those of pregnancy, so it is difficult to tell if a pregnant woman has maternal hypothyroidism. Nonetheless, some of the common symptoms are tiredness, depression, weight gain, feeling cold, dry skin and hair, and constipation. Diagnosis. Your first step in diagnosis is to get a complete medical history and a physical exam. This can reveal these common signs of hypothyroidism. To detect hypothyroidism, your doctor does a physical exam and orders blood tests to measure the thyroid hormone levels. TSH test. Thyroid stimulating hormone or TSH is a hormone that spurs the thyroid to make T3 and T4, also called thyroxine. High TSH levels plus low levels of T4 indicate hypothyroidism. Test for TPO antibodies. If you are hypothyroid, you may need an antibody test to check for TPO antibodies. These abnormal antibodies will be in the blood if the cause of the hypothyroidism is Hashimoto's disease. Treatment is available. The best mode of treatment for your thyroid disease should be such that it is not harmful to your body as well as your baby. Here are some common treatments. The most common treatment for hypothyroidism is thyroid hormone replacement with a synthetic form of T4 called levothyroxine. This drug is safe for pregnant women, but do discuss the dosage with your doctor because excessive use can lead to hyperthyroidism. Before pregnancy, it is important that thyroid hormone levels are normal both before and during pregnancy. If you are already receiving levothyroxine to treat hypothyroidism, you should have your thyroid hormone levels checked before you try to conceive. Once a hypothyroid woman becomes pregnant, the levothyroxine dose often must increase. Possibly, the dose must go up by as much as 30% or more in the first 4 to 6 weeks of pregnancy. Prevention. You can take some preventable measures to steer clear of this dangerous ailment that is maternal hypothyroidism. These are: eating a proper diet with the focus on calcium and sodium is important since the thyroid hormones are mainly formed of iodine. Deficiency in iodine will mean that your thyroid cannot produce sufficient hormones, leading to hypothyroidism. Also remember that exercising is important to prevent maternal hypothyroidism. A sedentary lifestyle can be harmful to your baby's development as well. If your doctor prescribes some food supplements with iodine, do not forget to take them. You need to tell your doctor if you have any prior thyroid-related diseases as well. Do not forget to tell your doctor if any member of your family has previously suffered from thyroid diseases. We hope you got a comprehensive idea about maternal hypothyroidism from this video. Pregnant women with uncontrolled hypothyroidism can get high blood pressure, anemia, muscle pain, and weakness. There is also an increased risk of miscarriage, premature birth, or even stillbirth. So you need to be concerned and have a balanced diet, healthy exercise routine, and take good care of yourself so that you can prevent this pregnancy complication. That's all from us today. We want you to know that your voice is important to us, so please leave a comment below. If you're new here, then click the bell icon for notifications of our new videos. For more content, visit our website www.thevoiceofwomen.com. Till the next time, stay safe and stay healthy and let your voice be heard.